Helicobacter pylori. How is the diagnosis done? What's the possible relationship between Helicobacter and stomach cancer? And how does the treatment work? Very interesting topic. You must be quite eager to watch. But hey, this is the second part of the video about Helicobacter pylori. If you haven't watched the first part yet, go there first, take a look, watch attentively, and then come back here. The link is up here and also here in the description. If you've already watched the first part, then you're all set. Let's get to the video. I'm Carlo Cunha, I'm a family doctor, and this is my health pill for today. The first thing I want to answer is about the diagnosis. How does a person find out whether they have Helicobacter or not? And in this response, I'm also going to address another question that people often have about reinfection. What's that? It's the situation where a person had the diagnosis, underwent treatment, and sometime later, often after a year, 2, 3 years, they take another test because they continue to experience symptoms or because symptoms returned after a period of improvement, and then the person tests positive for the bacteria again. Many patients ask me if they got it again, if it's a reinfection. So, let me start by answering this question. Reinfection by Helicobacter pylori after a successful cure is not common. Most of the time, what happens is that there was a treatment failure and the return or persistence of the original bacteria that was already in the person's stomach. When the treatment is successful, the chances of reinfection in adults are low. Those who have had Helicobacter and managed to eradicate it are more resistant to the bacteria's return. One of the reasons can even be the immunity the person acquired during the first infection. Regarding the diagnosis of the bacteria's presence, here's how it works. Generally, the most commonly used tests are direct tests performed through digestive endoscopy. A person undergoes an endoscopy requested by their doctor, usually because they have symptoms that we doctors call dyspeptic symptoms, pain, fullness, early satiety. During the endoscopy, there are 2 tests that can be conducted to identify Helicobacter: biopsy with anatomopathological examination or the so-called urease test. There are 2 other non-invasive tests, meaning they don't require endoscopy. These are the breath test for Helicobacter pylori and the fecal antigen test, which is done with stool samples. However, it's important to know that these non-invasive tests are more commonly used as follow-up after treatment, as a way to confirm that the bacteria has truly been eradicated. Another important thing, my friend, is, as I mentioned in the first video, there are places with a very high prevalence of Helicobacter pylori, 65%, and in some places, more than 80% of people live with the bacteria. That's why these tests should always be requested after a thorough medical evaluation, especially when a person presents symptoms and complaints related to the stomach. Now, following the outline of this 2-part series on Helicobacter pylori, to wrap it up, I'm going to tell you 2 more things: whether there's any connection between the bacteria and stomach cancer, and also give you a word on treatment. First, yes, Helicobacter pylori is not the only factor, but it's recognized as one of the risk factors for stomach cancer, especially for people with a family history of stomach cancer. There's a strong link between Helicobacter pylori and the development of a type of stomach lymphoma, MALT lymphoma. This connection is so strong that Helicobacter pylori eradication therapy forms the basis of treatment for stomach MALT lymphoma. Second, to conclude, the most current treatment recommendations to eliminate Helicobacter include individuals with dyspepsia symptoms, gastritis, ulcers, both in the stomach and duodenum, people with iron deficiency anemia, or with idiopathic thrombocytopenic purpura, people with MALT lymphoma as I just mentioned, and also in cases where a first-degree relative has a history of stomach cancer. In general, a 14-day treatment regimen involves using 3 medications, a proton pump inhibitor. There's a video on the channel where I talk a lot about these medications. It's omeprazole, pantoprazole, lansoprazole, and 2 antibiotics, clarithromycin and amoxicillin, or another regimen with clarithromycin and metronidazole. Of course, this is just informational guidance. You should only use these medications after a thorough evaluation with your doctor and always with a medical prescription. That's very important. If you enjoyed this content, don't forget to leave a like. After all, there were 2 videos just about Helicobacter pylori. It really helps by encouraging YouTube to share this video with more people. Also, subscribe to the channel and hit the notification bell to receive updates whenever a new video is posted. I'm Carlo Cunha, a family doctor, and this was my health pill for today.